Hello, beautiful people. My name is Rodney. I'm duly enrolled in 2 doctoral programs, one for naturopathic medical school and the other acupuncture or traditional Chinese medicine. I am currently in my 7th quarter. So we're in our 2nd year, doing well, alhamdulillah. And my intention for today is to kind of shed light on what is the importance of having a good elimination process within your body systems. This previous week, I learned in my microbiology class that we're currently talking about different types of bacteria and how they may cause disease or illness within the body. So, so we're learning, kind of the basics or being introduced to the generalized view of microbiology. So, gram-positive versus gram-negative bacteria, and then some of the common pathogens or associated with that, like E. coli and salmonella, things of that nature. But in a general broad view, the difference between gram-positive and gram-negative bacteria is the structure of their cell wall. So the gram-negative bacteria has 3 layers of protection, while gram-positive have 2. And what that means, what I have found, and the importance of that is with gram-negative bacteria specifically. So like E. coli is a good example of that, is that they have a lipopolysaccharide layer, which can be quite detrimental to the system. So essentially, this can aid this class of bacteria in becoming antibiotic resistance. So you hear a lot, especially in like a hospital setting, that there's like this fear or this state of caution on how many bacteria or different types of viruses and pathogens are developing resistance to antibiotics or various forms of treatments. And that can be a result of various compounding factors. For instance, when antibiotics became more widely used, like you have broad spectrum antibiotics that are often administered in a hospital setting for like acute infections, because now there is some benefit or rationale in administering that type of pharmaceutical medication, because sometimes like if a patient comes to the doctor or presents an ER depending on how far their symptoms have progressed, you may not necessarily have enough time to test them, like whether that's like an oral swab or a blood test, and then culture them, because sometimes these, depending on the strain or the bacteria, some of them may take 24 to 72 hours to incubate before you can see the growth of whatever that pathogen is on the medium in order to identify it, to elicit a more specific form of treatment. And again, going back to how far along their symptoms are, from a pathological standpoint, that patient might not necessarily have that amount of time to wait for a more specific form of treatment, or to identify what it is specifically that may be plaguing them. So a broad spectrum bacteria comes in handy because it kind of eliminates a broad spectrum of pathogens. Now the caveat or the issue that presents with that is, over time, with all of the number of people for various infections being prescribed as like a standard form of care, a broad spectrum antibiotic, you're kind of eliminating all bacteria that fall within certain classes or categories, and that can raise issues because you have the instance of developing resistance, so there might be a percentage of pathogens that survive and don't die off, and based on what genes or mutations they have that have made them valuable in order to survive and reproduce, kind of feeding into that ideology of natural selection, then they may survive, reproduce, or there's also a process called binary fission where two bacteria can have like a sexual intercourse or a interaction, and they can exchange genetic material. And so if one strain here has antibiotic resistance and another doesn't, and they undergo this process of binary fission, then now this new strain has acquired this trait of resistance, or this mutation of resistance, and then each of them will go on to replicate and divide and increase in number, with all these, with their progeny having carried this resistance. And so then you have all these strains floating around that are not responding to these various therapeutic treatments. And so this can be a big problem, like in hospital settings, because you have various pathogens, like just by the nature of the environment. You have people coming from everywhere under the sun for various conditions, and it's not necessarily a sterile environment. And so you may have an instance where that cosm or microcosm of a environment has acquired all these mutations for resistance. And then if you want to take it a little bit further, then that stuff can end up in water treatment and water supply, and Some of them may be airborne. So yeah, it can create a host of problems. More story. So going back to gram negative in their lipopolysaccharide layer, um, what I found interesting is that it's not inherently the bacteria that causes the disease, but it is their lipopolysaccharides. So if they are treated with an antibiotic and the antibiotic begins to like degrade the lipopolysaccharide layer, it fragments, and it can end up in your bloodstream. In the most extreme case, this can produce like septic shock, where you have a systemic reaction. Essentially, it's almost like a anaphylactic reaction, and this is actually termed Alzheimer reaction. And so it's actually the endotoxin of the lipid polysaccharide that is producing the reaction or an immune response. So your immune system begins to attack those lipid polysaccharide fragmentations, or they end up in your system, and that actually is what produces illness. Like for E. coli, for instance, that's what produces diarrhea. In extreme cases, a more extreme variation of that is cholera, which can be really severe because cholera, you're just like expelling like liters of diarrhea, and that can induce like severe dehydration, and even though you may be in a hospital, it's quite challenging to replenish all the electrolytes and then fluids that are being lost in such an extreme rate. So for these reasons, this is why it has come to my awareness that it would behoove you to have a consistent elimination routine, throughout your week or the month, so that you are ridding yourself of any toxins or waste products that are not serving your wellness. So whether that's through sweating or detox, like with activated charcoal, or some other type of binder that can grab onto various toxins and eliminate, or if it's incorporating hydrogen water, or they have like little hydrogen tablets, you can add that to your water, and those help to eliminate like free radicals and any other oxidative stress in the body, as well as like staying hydrated is a really big one as well, because that will also kind of help flush out any toxins and waste byproducts that are being produced, because as stated before, what drives symptomology to an infection really is not inherently the bacteria in itself, because you have a lot of these bacteria live within us or on our skin as either like a symbiotic relationship, like in your gut flora. A lot of bacteria may help to break down food, or they have like a mutualistic or commensalistic relationship, like on your skin, where it's not necessarily harming you, but is benefiting the bacteria, and they're just there. And some of the issue comes is when ratios become out of balance. So like if you have there are some studies like with you have candida as part of your normal gut flora, as well as in very, very, very small percentages like C. diff, believe we're like in the like lower intestines, the colon, as well as Staph aureus, and so like if you get an infection and say you take an antibiotic and you eliminate all the bacteria in your gut flora, well then you have a opportunistic infection that can occur. So you may get candida overgrowth, and candida is a form of yeast, so you may acquire a yeast infection. So it's imperative that you maintain the integrity of your normal flora, whether it's on your skin, like your skin barriers, or in your gut, or even oral, so that things stay in check and don't become out of balance and can create a opportunistic environment for things to go awry. And essentially that's where disease and various pathology